Hi everyone, welcome to Health Vibe, your health and wellness lounge here at the Philippine STAR. I am Kai Magsanok, features editor of the STAR and a health and wellness advocate. And today we will be talking about a disease that we discussed in the previous episode. Hopefully po napanood ninyo yung interview namin with Attorney M. Villar, who is a lupus warrior. Today we will be speaking with someone who is helping her and many other patients fight the fight against lupus. Actually, mamaya, pag na-introduce ko na siya, hindi ko talaga mag-gets kung bakit mas kilala siya. Pag nakita nyo kasi si Doktora, parang, pain, tsaka lupus, ganyan. But how she is very helpful to patients. So let me introduce her properly. Dr. Geraldine Zamora Abrahan is an associate professor at the University of the Philippines, Manila, and is a member of the Philippine Rheumatology Association. She graduated class valedictorian from the UP College of Medicine and did her postdoctoral at the Cedars-Sinai Medical Center in Los Angeles. Her passion is geared towards the underserved. Vice President of the Sagip Buhay Medical Foundation, co-founder and Vice President of the Hope for Lupus Foundation. Doc Ging, as she is well known, you can find her on X, on YouTube, on Facebook, and IG, teaches Filipinos about health on her social media pages, for which she was awarded the 10 Outstanding Women in the Nation's Service Award in 2019, and before that, the Outstanding Young Men of the Philippines Award in 2016. I'm very happy to have with us today Doc Ging. Hi, Doc Ging.
Hello, Kai. Thank you for having me and for that introduction.
Siyempre, di ba? Parang pag nakita si Doc Ging, pain, ganyan. Parang hindi. Pero with yung pagsasalita ni Doc Ging, very malumanay eh. So, kailangan talaga natin yan sa ating mga doktor na hindi tayo matakot na magsabi or magkonsulta. Di ba, Doc?
Hopefully. Dapat naman.
Ayan. Doc Ging, thank you for finally coming to the Philippine STAR. Before Health Vibe, I've already been a huge fan because during the time of the pandemic, we were fighting the infodemic, the rampant misinformation and disinformation, and you have been one of the content creators that other content creators after you look up to.
Oh, thank you.
So thank you for coming.
Hopefully, I'm doing justice to content creating.
Yeah.
But that was during the pandemic. Nowadays, I haven't had enough time to do that. So there are many people now doing it. So it's a good thing.
Yeah, but I think you set the benchmark. You set the standards. That's good. Let's go into the meat and potatoes of our conversation, which is about lupus. In our last episode, we had Attorney M. Villar, who is a lupus warrior. And you're co-founder of the Hope for Lupus Foundation.
Yes.
So just from that, I can already tell that you are really very close to this disease, no? But we're talking about it on Health Vibe today with you for people who are either patients already or maybe not yet. Maybe they're feeling symptoms, and we want to help educate, inform them how to face it, no?
Yes, okay.
So, Doc Ging, what is lupus? And what are its most common symptoms?
So lupus is an autoimmune condition. So when we talk about autoimmune diseases, this means that the immune system of a person, instead of helping us fight off cancer cells or like bacteria, viruses, the immune system turns against us. That's why it's called an autoimmune disease. So lupus is just like that. There are many autoimmune diseases, but lupus is one of the more popular ones recently. It's a chronic disease. It's long-lasting. Sometimes it usually is lifelong actually. It's inflammatory, meaning namamaga. So hindi siya visible that you're swollen sometimes, but it just means that your cells, your organs can be swollen or inflamed. And this is a multi-system disease, which means it can affect many organs or any organ of the body, from the skin to the kidneys, brain, heart. Almost any part of the body can be affected. So its symptoms would vary depending on the organ affected. Kunwari, if your kidneys are affected, then you would manifest with swelling. Yung namamanas yung paa. Pwedeng mabula yung ihi, yung bubbly urine. Most commonly though, patients with lupus would feel fatigue. Diba? Parang ang simple, pagod, feeling pagod kahit nakatulog ka na. But it's very common among people with lupus. They can also have joint pain, masakit yung kasukasuan. And they can also have a rash. Any type of rash actually, but sometimes it's here in the cheeks. Or it could be yung rash na nakakasira talaga ng balat, nakakalbo sila, fever. So depending on the organ affected, parang yung symptoms would point to that. Some patients would have seizures if the brain is affected. Some would have intractable headache. Yung parang napakasakit na lang ng ulo nila, hindi nawawala. Some patients would have chest pain or even heart attacks at a young age. It could be the first sign of lupus. So that's why we call it one of the great mimics in medicine. Ang dami kasi niyang kamukhang sakit.
Right.
It can look like an infection, it can look like cancer, or other autoimmune conditions. That's why it's kind of hard to pinpoint exactly at the outset kung ano yung sakit ng pasyente if she has symptoms that are not very textbook-like in terms of presentation.
Right. That's why it's really important pag napakiramdaman mo na, no, na something is wrong,
Yes.
to go see your doctor.
Because it can look like so many things. So, pwedeng simple lang pala na viral infection. Pero yun pala, pwede rin siyang chronic disease, no, starting to build up.
Right. So going now into the diagnosis. How is lupus diagnosed and what are the different types of tests involved?
So lupus is diagnosed through a combination of physical findings and symptoms of the patient and yung tests. So there are certain laboratory tests that we can ask for in a patient who presents to us in the clinic. May mga tests that would check your blood. Let's say we'll check the blood count. Is there anemia? We'd like to check kung mababa ba yung platelets, kung mababa ba yung white cell count. We can check for what we call the anti-nuclear antibody. It's a test wherein you check may lumalaban ba sa nucleus of the cells. So it's just one of the screening tests for lupus. If it's positive, it's not always lupus. Ang nangyari kasi in the recent years, since more people are finding out about lupus, some of them would ask for the test for themselves and then they would be anxious when it's positive. Yun pala, hindi naman dahil sa lupus yung positive test. So it's just one of the tests. We can ask for other antibodies like anti-dsDNA, anti-Smith. We would check the urine, meron bang protein, meron bang dugo, and other tests. Sometimes we have to do imaging. So depende kung ano yung organ that's affected, pwede naming i-test yung organ na yon. The combination of positive tests and symptoms and physical examination can help us determine if this particular patient has lupus or baka iba palang condition.
Okay. So I guess, Doc Ging, ang baseline is really the annual tests, no? Tama ba?
In a way, pwede kasi sa annual test, at a certain age kasi some people are advocate for that, no? Or they get it because meron ng blood count doon, there's a urinalysis. Although, hindi kasama sa annual tests, yung tests for lupus. Kasi we don't really have to do it naman. Like I mentioned, pwedeng mag-positive yung mga tests for lupus in conditions that are not lupus.
Right.
So minsan, mas matatakot pa yung patient. For example, they have COVID recently. They can have a positive ANA. They can have anemia. They can have all these symptoms, fever, etc. Pero hindi naman siya lupus. Kailangan yung paggawa din ng test, yung pag-order, in relation din with the symptoms. Para wala tayong kakatakutan na false positive tests.
Alright, because it does happen also.
Yes, it can happen. It happens all the time actually. Yung
Okay.
mga-
That's why it's important to work with your doctor.
Yes.
Okay. So, speaking of lupus, I'll jump right into yung lupus treatment na,
Treatment, okay.
doktora, no? So, what is the current standard of lupus treatment, especially in an out-of-pocket healthcare market like the Philippines? Yan. Feeling ko marami nang nakarelate agad sa viewers natin.
Out of pocket for now,
Yeah.
yes.
Doc Ging, can you help us understand how this can potentially transform how lupus is treated here in the country?
So for treatment of lupus, as with any condition, merong what we call non-pharmacologic, yung hindi gamot, and then gamot. No? So for the non-pharmacologic, we advise people with lupus to avoid the sun, stop smoking or wag magpa-expose sa passive smoke. We advise them to have regular exercise and a healthy, balanced diet. Dapat maganda yung tulog, they're rested, so that they don't get sick easily, no? Now, if moving on to the medical part, yung gamutan, we have several treatment options available. Usually, ang gamutan depends on many things. But the most important would be kung ano yung severity, gaano ba kalala yung sakit. Kasi of course, like with any condition, pag hindi ganong malala, pwedeng isang gamot lang. Pag malala, pwedeng madaming gamot, no? And another factor would be kung ano yung gusto ng pasyente. Gusto ba niya iniinom lang? O gusto ba niya yung sineswero na mas matagal every month? Or gusto ba ng patient yung mura, as you said? And as we all know, most of our healthcare nowadays are still out of pocket, no? So yung iba, pipili sila ng mura. Yung iba, pipili sila ng what they think is important to them. So iba-iba ng priorities. But baseline, all patients with lupus should be prescribed what we call hydroxychloroquine unless hindi yun pwede sa kanila. So may mga taong hindi pwede yung gamot na yun. That's why it has to be a prescription medicine. And then some people will have to be given steroids. Kasi yung immune system in a patient with lupus, very hyper siya. Yung parang boosted siya na instead of nilalabanan lang niya yung mga mikrobyo, mga cancer cells, nilalabanan niya yung sarili mo. So we have to parang quiet down the immune system a bit, immunosuppressant. So steroids are the fastest acting medicines kasi for this. Although ang dami kasing side effect ng steroids, that's why as much as possible, pag binigay namin to sa pasyente, ang goal namin is maibaba siya as quickly as we can. So that's why in patients with more severe disease, kailangan namin mag-add ng ibang gamot. So yung mga ibang gamot na to, meron yung mga tinatawag na DMARD or disease-modifying anti-rheumatic drugs. May mga oral, no? And for example po, mga methotrexate, good for the joints. There's azathioprine, mycophenolate for more severe conditions. Cyclophosphamide, sinuswero po yun. Baka yung nanonood sa atin, baka mga gamot niyo po ito, no? Baka may mga nanonood po sa atin na who are familiar with the medicines. And we also have what we call biologic medicines. So currently, there are two US FDA-approved biologic medicines for lupus. So biologic meaning para siyang pareho na ng katawan ng tao, no? Versus the synthetic ones. These are belimumab and anifrolumab. And one of these biologic medicines are already in the Philippines. So the treatment is really based on severity. And ano ba yung naapektuhan na organ in a patients. Kailangan pag-usapan to ng doktor, no, at pasyente. What you are willing to do, what are you willing to spend for, ano ba yung priority natin, ganun. So as with any condition.
Okay. Aside from the new drug that's already here in the Philippines, what are the other latest research developments in lupus and other future directions in terms of treatment? Meron na ba kayong natutunugan, Doc Jean?
There are many clinical trials ongoing for lupus, not just here, but mostly also abroad. But we also have some here in the Philippines. And these trials are testing new molecules to help people with lupus, especially those who do not respond. Yung hindi sila gumagaling with what's currently available. But these would probably take more years kasi kailangan mo na makita na they work and that they're safe. And then eventually kailangan pa yun mag-pass ng FDA, but there are a lot of trials going on. We're just very lucky that at least for now, meron na ring mga effective treatment for lupus that has been used for many years. In the coming decades, I'm sure, like with other diseases, ang mga treatment ito would be targeted na, no? There would be gene profiling, ano kaya yung genes ng isang tao, ano kaya yung gamot na mas mag-work for a particular person. So hopefully, yun yung direction ng medicine.
Doc Ging, I'm always excited to speak with doctors because I kind of represent the patient. No? I feel like that. So kumbaga, this is lupus for dummies po, no? Take note, hindi po siya konsulta. Yung mga nanonood na mga, di ba, marami ring doktor naglilibreng konsulta. Hindi po yun konsulta. Education po yun para sa inyo. Please consult with your doctor. Okay? So, for the patients watching this episode, no, if I'm a lupus patient, how can I manage my symptoms and improve my quality of life? No, syempre, lalo na ngayon, Doc, we all survived the pandemic, right? And
Yes.
then I get diagnosed with lupus. How about my quality of life? And what lifestyle changes can I make to help manage the disease?
So, if you are a patient with lupus, and for people who are watching and have lupus, the best way to ensure that your disease is quiet, yung makokontrol yung condition nyo, is to keep on communicating with your rheumatologist. Magandang if they suggest something, sana pakinggan natin kung bakit, no? Kasi we won't suggest something that is not really meant for you individually. So like you said, ano siya eh, it's really a patient-doctor relationship, no? So it's important that you're able to tell your doctor how you feel, what your problems are, so that we can help you better. So yung mga gamot po sana will be taken with compliance. Kung maintenance. Yung iba po kasi parang they feel na, I feel better. And then they stop medications agad-agad, no? Not knowing na pag tinigil yung gamot, babalik po kasi yung symptoms minsan, no? Or usually. So, important po yung gamot, no? Kung sinabing maintenance or i-maintain until a certain time, maganda pong sundin. And then I mentioned earlier, it's important to have a good diet, balanced diet. Iwas po tayo. Usually kasi sa Philippines, madalas tanungin ano ba yung bawal na pagkain, no? So, sa mga taong may lupus, since we have inflammation, pwedeng magkaroon ng problem sa cardiovascular system natin, we advise patients to eat less fat, less salt, less sugar. So actually, hindi lang po yan sa mga taong may lupus, diba? It's really for everybody na. Supposedly, we eat less of these sinful food, mataba, maalat, matamis. Wala naman talagang pagkain na bawal sa lupus, no? Except what we call yung alfalfa sprouts. Na-associate po ito with lupus in some studies, but hindi naman siya laganap sa Philippines. So, it's not something we should be afraid of. We have to be exercising. Movement is important. Smoking cessation, wag pong manigarilyo. Pag meron na pong medical condition, it's only going to make it worse. Dagdag ko na rin po yung vape. It's not specifically for lupus, but it's really not a very good substance to be hooked in. Dami na namin nakitang pasyente na nagka-problems, no? And a positive outlook, if I could say this, no? Some patients, they need to understand that you can still live a good life, even if you have lupus. We'll help you with that. And hopefully, you can also maintain this positive outlook na you'll be better. Kasi yung iba po, kung iniisip na nila, puro negative na lang, mahirap kasing gumaling eh. Kung parang defeatist na, no, parang hindi na ako gagaling, mamamatay na ako. Ayoko nang inumin yung gamot ng doktor ko na piniprescribe. So, support from your family, from your loved ones would be important. And whatever your religion is, no, I still believe in a higher being that, you know, can help us.
Right. And if you are literally looking for a support group, there's the Hope for Lupus Foundation. Doc Ging is a co-founder. You'll find them on Facebook, and if you Google them, labas agad yung ano nila, yung website nila. No, just reach out to them. Doc Ging, totoo ba na mas delikado ang babae or mas tinatamaan ang mga kababaihan ng lupus?
Yes, you're right. No? So, it's more common in women, especially sa reproductive age, as sinasabi natin, yung pwedeng mabuntis na edad. Pero, pwede pa rin magkaroon ang bata and matanda, and even male. So, it's not exclusively for women. Mas madami lang talaga. And usually, this is because of our hormones, and maybe genetically, mas predisposed ang mga kababaihan. Pero yun po, may mga pasyenteng mas mga bata pa. That's why we also have our pediatric rheumatologists in the Philippines.
Okay.
So, pwedeng bata, pwedeng matanda. Pero mas madalas na sila sa kababaihan.
Okay. Speaking of women, how about those who are pregnant and they are lupus warriors? No? What are the risks of lupus during pregnancy?
So, in the first place, actually, if your lupus is very active, baka mahirapang mabuntis. We advise patients who have lupus na baka pwedeng i-delay mo na yung pagbabuntis until the lupus is already controlled for about 3 to 6 months para yung pagbubuntis mo, pag sulit na, yung parang lesser chance that you may have miscarriages, lesser chance na magkaroon ng preterm delivery, because that can happen in a person or in a woman with lupus who is pregnant. Pwedeng magkaroon din ng complications, of course, yung baby, no? And in people with lupus, merong mga antibodies that we can check For example, yung mga anti-SSA, anti-SSP. Kung positive sila nito, there should be close communication with your OB.
Alright.
Baka i-refer po kayo sa cardiologist ng babies, no? Because there might be an issue with the baby's heart. Meron din po kaming pwedeng i-test ng mga antibodies to check if you're prone to miscarriages. It may be beneficial na ma-refer din sa immunologist. Baka may kailangan pong gamot na, for example, i-inject sa tiyan every day, no? So those people who are watching who may have this will be familiar with this condition. So dapat controlled sana yung lupus before we get pregnant. But if not, then of course we'll help you. Your OB will help you. Everyone can help you. Basta you can tell us what the problem is.
Wow. So it takes a village.
It really takes a
Talaga.
village. Lupus is a multidisciplinary condition. Many conditions naman are like that. Yung kailangan ng nagtutulungan for a patient.
May care team, kumbaga.
Yes, oo.
Wow, I feel supported. And I'm just the host interviewing Doc Ging. Thanks, Doc. I had to insert this question, no, yung about young children getting diagnosed with lupus. Kasi this was also something I think I asked about cancer.
Okay.
No? When I was
Before.
speaking with an oncologist, na why do children get cancer? No, when they're very young, their cells are very young,
Oo,
diba?
bakit?
Why does it happen, Doc Ging?
So in lupus, you mean?
Yeah.
So anybody with an immune system actually can have lupus kasi it's simply an immune system issue. So autoimmune disease siya. So even children, even babies have immune systems that can go haywire for whatever reason. Maybe genetic siya, namamana, and then they have enough triggers para lumabas yung condition. So pwede talaga itong mangyari sa bata. And even the elderly population. Basta I think anyone with an immune system and may genetic predisposition. Kasi ang lupus is really a gene issue, no? Genes siya. Polygenic, meaning maraming genes that can be inherited, that can affect the immune system para labanan yung sarili. So, hindi po ito nakakahawa. I think that's one of the most important messages also that we can share kasi baka yung iba matakot lumapit. So, hindi siya nakakahawa. Hindi porke meron ng isang nanay, magkakaroon na yung anak. Kasi nga polygenic siya, hindi naman kailangan makukuha ng anak lahat yung genes. And even if you have all the genes to push your lupus out there, hindi, baka yung iba wala namang trigger. Ang triggers are infections, sunlight exposure. People with lupus should be avoiding the sun, yung UV rays. Kasi yung spectrum ng UV rays, pwedeng masira yung balat, and then yung mga nasisirang particles, some of these will be thought of by the immune system as foreign. Akala niya foreign body, lalaban siya. Pag meron kang genetic predisposition and you have the triggers like infections, severe stressors, sunlight, and drugs, pwedeng lumabas yung sakit. So, hindi siya lahat, hindi automatic na pag meron yung parent mo, magkakaroon yung anak. Hindi naman ganun.
So there is hope.
There is really hope, and it's not
Okay.
really a death sentence if you have lupus. It can be managed. You can live a good life even if you have a medical condition. Parang yung mga may diabetes, di ba? May high blood pressure.
Right.
You don't really notice nga na yung isang kausap mo mayroon na palang diabetes, pero they have maintenance medicine. That's why they seem normal, and they can live good lives.
Okay. Speaking of management, I am a part of a lot of lupus communities on Facebook here, and pag dumadaan sa feed ko, a lot of them either dahil may lupus patient na bata or they're having a hard time with the cost of
Yes.
treatment, no? This question begs to be asked, Doc Ging. Is there government support for lupus patients? Do they get coverage or are treatments reimbursed? And what can we do to support this?
At present, there is the PhilHealth. There is coverage for patients with lupus who are admitted. So it's usually an admission process. So naka-admit sila, and portion of their bill would be covered by PhilHealth, no? Some patients also get this as an outpatient benefit. Pero yung mga nabibigyan ng gamot through the IV, through the veins, so this can be also covered by PhilHealth, yung gamot, yung infusion center. There are also several NGOs that support, and private organizations that offer support. Although we're still not at that stage in the Philippines compared to other countries wherein our healthcare is 100% covered. So some of my patients and other rheumatologists' patients, they have private insurances.
Right.
And then these help cover for the patients consults or admissions. Not everybody has that, no. So for the most part, PhilHealth covers a percentage of the admissions kasi hindi pare-pareho yung ginagawa sa mga pasyente. Sometimes it's really not enough because a patient's admission will be longer, magkaka-infection siya, hindi na yun part ng lupus mismo na package, and they really have to pay out of pocket. So hopefully it improves.
Yes.
As well as with other conditions.
Yeah, hopefully it improves. Yung ramdam kasi natin lahat
As an out-of-pocket, usually kasi here, medyo out-of-pocket pa po mostly ang natin, ang gamutan.
Yeah. Okay.
And those who can afford, they're the ones who have good insurances din naman. Sila yung nako-cover. But yung mga nasa, yung mga medyo hirap din to get insurances of their own, medyo hirap din talaga sila. But PhilHealth does have a program.
We hopefully in a different episode will be able to talk more about the PhilHealth program, Doc Ging. In closing, my question is a pain-free life possible for a lupus patient, or is it my friend na until the end, yung pain?
So yes, it's possible to have a pain-free life if you have lupus. It's possible to not feel fatigued. It's possible to have good hair, good skin, no symptoms if you have lupus. But usually this means that you have to be compliant with your medicines and you are in touch with your rheumatologist regularly. It's just that lupus also comes sometimes with a flare. Yung mga nanonood po, they know what a flare means. Sometimes, for example, stable yung lupus mo, quiet siya, nakagamot ka, maganda yung pakiramdam mo, and then you get an infection or you have a very severe stressor, and then your lupus will flare. Nangyayari din po kasi yun and then your symptoms will be back, you will have swelling, you will have protein in your urine, pwedeng magka-problem. So, pwede namang dagdagan yung gamot at that time para makontrol. Pag na-control na, pwede rin tanggalin ng rheumatologist ulit yung gamot na yun na dinagdag lang for a particular flare. So, yun, it's a lifelong condition, but it's really possible to have a good life
good
while you
quality.
have lupus. So, like with many other conditions, actually, sa lahat naman ng sakit na affecting humans, parang yung cure naman talaga is not really something we aspire for. Kasi parang rare na rare yung cure Di ba? Kung meron kang boil, may pigsa ka, yun, pwedeng magamot yun, Antibiotic, matanggal siya, mawawala siya. But for the most part, lupus, hypertension, yung high blood pressure, diabetes, mga gout, these are long-lasting conditions, like lifelong conditions. But you can control them, you can manage them, so you can have a normal life. Yun lang, meron kang maintenance medicine, and this actually helps you extend your life.
Doc Ging, thank you so much for being part of this episode of Health Vibe.
Thank you for having
Siyempre,
me.
bago natin iwanan ng ating mga viewers na maraming natutunan ngayon about lupus, ano ang inyong last word or parting message to them for this episode?
So, parting message would be to consult, please, your physicians if you feel anything. Kasi kahit we're talking about lupus, hindi naman lupus lang ang conditions. Many conditions look like lupus, And if you want to consult any rheumatologist, the Philippine Rheumatology Association has a website. Meron dong Find a Rheumatologist na tab. So you can look for a rheumatologist near your place. So currently, there are about 260 rheumatologists already in the Philippines. Some of these are pediatric rheumatologists, and hopefully you can find one near your area.
Okay. Thanks, Doc Ging. So, whether lupus yan or hindi, kung may nararamdaman kayo, mabuti nang mag-contact. Reach out to your doctor, reach out to the PRA para ma-diagnose ng tama. Okay, tama ba, Doc? Did I get it right?
Tama. Thank you.
Okay. Thank you again, Doc
Okay.
Ging. So that ends this episode of Health Vibe. Thank you so much for joining us. Again, this is Kai Magsanok, your features editor here at the Philippine STAR. And until our next episode, please take care and be well.